Good day. Welcome to another edition of Spotlight on Mahopac Schools. Eric Gross, your host, along with Superintendent of Schools, Anthony DiCarlo. And Anthony, Happy New Year, sir.
Happy New Year to you too, Eric, to you and the family, and it's great to see you. We're hoping for an incredible 2021 with peace and health, and hopefully as we get through the year, back to some semblance of normalcy.
And a happy and a healthy New Year to all of our constituents out there in Mahopac land. It's been a crazy week, not only in Putnam County, with the vaccines finally beginning to be distributed. Anthony, we're going to be talking about that in a moment. But before we do, of course, the news that made international headlines this week was the horror that took place in Washington, D.C. Anthony, what message do we try to instill and give to our young people in public education today concerning a horror, a nightmare that happened the other day?
Yeah, I mean, one of the things that I've talked about since I've been here, and I know that, we've gone through issues, we've gone through things that happen, and schools are supposed to be the conduit for speaking to kids when current events happen, because they have an impact on their lives, on their families' lives, and they want to be able to talk about it. And one of the most important things that we have to do is give them that venue to do it, because sometimes they're upset, they're scared, and what our role is, and it's different, it's different on every level. Elementary is different from middle, and middle may be different from high school, but we have to be open to listening. We have to be open to making kids feel calm about what's happened, and make it a teachable moment without being able to say to ourselves, we're going to ignore it and it's going to go away. It's not going to go away. And I think one of the most important things that we talk about here at Mahopac is about problem solving, is about resilience, is about collaboration, is about cooperation. And in what I sent out the other day was really that, to talk about the fact that in a world in which we live, violence does not solve anything. What you want to be able to do is to sit down, to collaborate, problem solve, and work out difference. That doesn't mean that we can't have a difference of opinion, but it's the way that you treat one another with respect, and it's being kind, being a good listener, and trying to work together. And those are really, I think, skills that we always instill with our kids from the time they walk in here to kindergarten to the time they live in 12th grade. But I think it's our responsibility to have those conversations and talk about it. The worst thing we can do is to ignore it and think it doesn't exist when it is on our kids' minds. And it's something that we have to say, guess what? This is the way that you don't go about looking to do things in a society, especially in a democracy. So, our kids have not been in this week. As you know, they're coming back next week. Although, instruction's gone on remotely. But I'm sure as they come in, they may have some questions and concerns. And we're helping support our staff. I know, and Dr. Stowell in his role of PPS and director of that and special education is also really working very closely with Mr. Tremblay, because our staff needs support also. Our staff, just like our kids and community, we've gone through a lot this year. We've gone through a pandemic that we've never had happen in our lives before, and that brings on emotions and different things going on. You have now what happened in our country a couple of days ago. That further tethers it. So as a educational institution, we have to be here to support our kids, our staff, our faculty, and the community at large during these very, very difficult times.
Greg, have you talked to any of the faculty members? Well, this is Greg Stoll, Dr. Greg Stoll, Assistant Superintendent here in Mahopac. Have you talked to the faculty about this at all? Or have you discussed this with any of the teachers?
Well, Happy New Year, Eric.
Happy New Year.
And Happy New Year to everybody out there. This is certainly, the current events have certainly happened. We haven't had a chance to really recircle and really break it down. We're in a constant crisis, as Mr. Carlos said. We're in a global pandemic. We had the unfortunate and horrifying incidents that happened in our nation's capital this week. And a crisis is anything that destabilizes an organization. And we are in a constant state of crisis, and that comes with an emotion. So what we're going to do next week is welcome our kids back. We've been through crises before as a community, and our buildings are going to get together. Their emergency response teams are going to get together, talk about how do we thoughtfully, respectfully, and appropriately have these conversations amongst each other as staff members, help support our kids, make sense of the world, feel safe, that the world is a safe place to be, that schools are the safest place to be. That is our moral imperative, and that's what we're going to do next week. It's going to be a process, Eric. It's not going to happen overnight, and we just have to do it in a thoughtful, supportive, and as one of our core values is, in a compassionate and resilient way.
Mayor Pack's always been a front runner out there. Something happens, it's not hit under the rug. Mayor Pack comes out and says, yes, we have to address this.
Yeah, and we have, and I think to the credit of what Dr. Stowell is saying, this community has gone through a lot of tragedies, probably more so than a lot of other communities, and probably the last almost, 2 decades. And so it's sad to say that we're pretty good at it because we've had to deal with it, and this is another part of what falls under that. So you're right, Eric, and I think to Greg's point, it doesn't happen in one day. It's going to happen over a series of days and weeks and months as we go through.
The other big issue, of course, deals with the pandemic. As I said moments ago, the vaccine began being distributed this week. The 1A group, the emergency responders, the doctors, the nurses, hospital staff, teachers, I understand, and school personnel are 1B.
Yes, this goes to our conversation that we're going to get into a second. Things are forever changing. It was originally 1C, now it's 1B, and literally sometimes, and Dr. Stowell will tell you, day-to-day things change. Right now we're R1B, and from what that means is maybe within the next couple of weeks they'll be rolled out. Now, how they're going to be rolled out, Eric, that's still up in the air and discussion. But I know Dr. Stowell and myself are constantly, on a daily basis, in contact with Shanna Segal, who we've had on our program, and she's really working hard with the school districts to see how those vaccines may be disseminated. But as a part of that, over this week, Dr. Stowell and our school nurses and all of us have worked together with our principals in what happens now if we fall under a designation by the governor to be a zone, and we don't know whether it's going to be a county zone or a regional zone, that now we'll have to test to keep our schools open. And Dr. Stowell is going to go into depth about what we're doing, but I just want to let the public know that we have a plan ready. Monday, I'll be sending it out to you. We'll give you an overview of what it looks like. Dr. Stowell will go into depth about what the expectations are and how you'll be selected and what we're going to do. But I really need you to understand that in order for us to do this, we need all hands on board, especially our nurses. So when and if we have to roll out the schedule, and Dr. Stowell will explain to you a little bit, and it'll be in the letter on Monday, we're going to have to take some asynchronistic learning days remotely so that we can test over a 4-week period the 20% needed to be able to stay open. So there's a lot that's gone into it. I want to thank Dr. Stowell for his leadership on this. I want to thank our nurses for collaborating and talking to us about what made the best sense to do. And if we have to, of course, we'll give you ample notice, but we're going to lay it out so that if and when it does happen, you're prepared and you understand what we need to do.
Okay, Greg, the numbers continue to increase in Putnam County. Town of Carmel, the largest town, is almost 1,700 residents since this pandemic began, infected with COVID. So what's the latest you can tell us?
Well, to Mr. DiCarlo's point, we know that in order to stay open, if we're designated either as a microcluster or a zone or a regional zone, as Anthony has said, that guidance changes all the time. So what we tried to do is develop a plan that is flexible enough, scalable enough that no matter if we're a micro zone or a regional zone, we have a structure in place. And what we're going to do is, it sounds really easy, just test 20%, but we're talking close to 900 people we have to test in a 4-week period. So what we have been working really hard on, I have to thank our school nurses, thank our building principals who have put their thought through how do you not just test people, but how do you get them in, how do you get their consent, how do you roll them through, keep them safe so that we're not congregating, we keep our social distancing. So we have a plan where in a 4-week period, we'll get a portion of our elementary schools, we'll get a portion of our secondary schools. The second 2 weeks of that 4-week period, we'll get the remaining 20%. And what we've done, as Mr. DiCarlo said, we will randomize who gets selected so that it's equally distributed amongst the buildings and amongst the districts, so that if we have to test, we have a plan. People will know. We'll send the information out well ahead of time, and it'll be a safe, expedient, and efficient process.
When you say randomly tested,
Mm-hmm.
will it be like number 1, 3, 5, and 7? Will parents be contacted first and say, can your child be tested in school?
Sure.
How will that work?
So how it works is we know who our kids are in our school. We know what school they go to. We know our staff. We just do a randomized sample equally among the students and the staff and the grades, and you're randomly selected. So if you're randomly selected because we have to test, because the state says we have to test, you'll get an individual notice via email. It'll give you all the instructions of when to come, what you need to bring with you, and then what will happen during that period. And it'll also have the instructions of what to do if your child is negative or positive, or if you're a staff member, if you're negative or positive. So we'll explain all of that. And if you don't get contacted, it just means that you weren't randomly selected.
Just to play devil's advocate, I don't want my kid tested. What happens then?
If you don't want your child tested, that's fine. We're not going to force anybody to be tested. However, the caveat to that is we may have to go down the line and find other people, because we have to get to whatever percentage New York State says. So, obviously, if there's reasons that people have for not being tested, we respect that. We would ask people to consider it strongly, because the quicker we can get people in, the quicker we can get people tested, the more certain we'll be that we'll be in compliance and hopefully be able to keep our schools open. Because at the end of the day, that's what we want to do. We want to keep our schools open. We want to get our students in our classrooms in front of their teachers to the greatest extent practicable. And we want to make sure that we comply with our requirements in New York State.
Yeah, and I want to just kind of piggyback on what Dr. Stowell just said, because there's some, I think, misunderstanding what the governor is saying. The governor's saying, yeah, school districts and school personnel there's not transmittal. We want to keep schools open. That does not mean going back to everybody in school. There's a misnomer, and people are reading it very differently. We're going to test because we want to stay with our hybrid model. Why would we go to what's working effectively with masks and 6 feet apart, which is the guidance, to now bringing everybody back into a classroom, and then, God forbid, we're back to that. So that is not what this is about, because there's some misnomer about that. And let's be honest, and Dr. Stowell is right here. We're looking to be able to normalize and stay with our hybrid model for as long as we're going to need to this year. Is there always a possibility? I don't know. At the end of the year, if the vaccines are in, whatever, but I can't project out that way. But I can tell you, at least for the immediate short term, we want to keep our kids in, and we want to continue to go with our hybrid model. That's the goal for what the testing is about. But I don't want to confuse, because some people are saying, but Mr. DeCarlo, the governor said schools can be open, and they're interpreting that open means going back to having everybody in the classroom and not have to worry about it. That's not what the guidance is. And it's important to understand that.
So as they say, stay tuned. That's the best advice we can give the public right now.
Yeah, I mean, stay tuned. As soon as we know, and we may not.
Yeah.
We may not know. But I want to just explain quickly about this test so people don't panic. It's called a Binex test, and Dr. Stova can probably speak more to it better than I can, and I know our nurses are looking at it. It is not one of those tests, and if you've had to take the COVID test where you're sticking the swab all the way up the interior, it's not. It's the anterior. It's very quick. It's a very quick administered test. Of course, elementary school parents, you're going to have to help us with your child and whatever. But I don't want them to think it's as invasive as the quote unquote PCR all the way up. It is not that way at all. Right, Dr. Stowell?
Yeah, Mr. DeCarlo, it is a rapid antigen test, and it is quick, 5 to 15 seconds or so to get the sample from the swab, and it is not one of those tests that are uncomfortable at all. Just an inch or so in the nostril. That's pretty much it.
Right, and Dr. Stowell, to his credit, is really working with the school nurses, and the schedule is really laid out so that even if in some cases, and especially we see more of the contact tracing at our secondary levels, And the way that Dr. Stowell has laid it up is that those Mondays will be those testing days. So God forbid if, and it will happen, that somebody may be positive, we go back 48 hours, it's over the weekend. So we're hopefully not gonna have as many people having to be quarantined. And as you know, the quarantining protocols have also changed since we've last spoken. So we're to 10 days now and not 14. So as we say, things are evolving all the time.
Great.
And just a quick update while we're here on sports. So we've started our low-impact sports. That's skiing, that is indoor track, although a lot of it is outdoor because of the framework. We also have gymnastics that's on. And I believe I said bowling also. So they are in place. We are still waiting, and I have to be very honest. Parents of student athletes that are in the high-risk sports, and I have to be honest, I've been very vocal with this. You have to ask the governor to make a determination. This is just either we're playing or we're not playing. And if we're not playing, that's fine. But we talk about social and emotional, as Dr. Stowell says all the time. There's got to be, because what we're finding out is that it's really having an impact on our kids. They really want to know whether or not it is or isn't, and then let's be able to move forward with that. It's something that I know that the students are starting to mobilize, just like we talk about advocacy, right? Students and parents have to start to advocate and have to say to our elected officials, you got to give us an answer to what we're doing here or not. Not knowing is just not social emotionally healthy.
Are the young athletes practicing?
So yes, of course the ones that are actually in season now are practicing. We are, and again, we have to be very careful because, as we know, it's very different indoors as opposed to outdoors. So we did, and we were able to run a pretty successful fall outdoor season, and I think indoors is more the issue. So that's being something that not just Mayapack, but everybody's looking at, and that's why we'd like the governor to make a determination. Because if you're going to have the sports that are the winter high-risk sports, what we want to do from a health point of view is allow kids, again, socially distanced, to be able to practice so that they're not just going out there. And that's when you're having all these injuries. So if we're going to have it, you got to give us some lead time to get us ready before you do it. And that's what we struggle with. So yes, the sports that are low impact are running. They are practicing. Games and meets are going to start in the next couple of weeks. Those other sports, we are still on hold. But there's going to come a point, and I'm going to tell the parents very shortly, that there's going to be a date that there's going to be no return.
Yeah.
So if we don't get an answer by the end of January, I'm saddened to say that most likely there will not be those high-risk winter sports offered this year. Because there just comes a point where you just don't have the ability to squeeze it all in.
Budget season is right around the corner. Have you heard anything from Albany now with the changeover?
Yeah,
in
so
the
it's a great conversation. So originally, when we spoke about, 3 or 4 months ago, and Dr. Stowell in the cabinet, we talk about this all the time. We were looking at a very, very, very difficult situation of cutting 20%. Matter of fact, they keep talking about, stuff that they told us that they were going to pay for, and they were going to give us state aid on it. And now one of the things they're talking about is STAC. And, whether or not they're going to give our teacher assistants or aides that work with kids, we're going to get our STAC money for that. So there's different things that are out there. I don't see it being the 20%.
Okay.
That I don't see it being. I think there may be, and I think the governor has said, and some of the elected officials have said, it's not going to be 20%. It may be a percentage, but nowhere near the 20%. And I think what he's saying is now, we're looking at for the federal government. We're seeing what they can do. He's basically saying that I'm going to have to wait till the end of the fiscal cycle for the state, which is the end of March.
Yeah.
We're hoping, as a cabinet, that we know a little bit sooner than that, because we have to try to plan for what that looks like next year. I always say, if we can keep things status quo, meaning the things that we've had and the things that we've built and the programs we've built, if we can keep that status quo, that's going to be a very good thing. And that's what we're hoping is going to happen. But we do have to be ready, just in case, whatever that may be, to look at where we can have some cost savings along the way.
You want to add anything, Greg?
No, I think Mr. DeCarlo said it well.
Okay, all right. You'll have to check with him too.
Yeah, no, listen, I have to tell you something, and this is to the people in the audience at home. I'm very, very fortunate and blessed to have a great group of cabinet members, all my assistant superintendents, Mr. Trombley, Dr. Stolo, Ms. Clohesi, and Ms. Legato. Remember, we've never been through this before either. And I can tell you that this group, we meet every single day. We're problem solving every single day. We're trying to do the best that we possibly can from an instructional point of view, from a social, emotional point of view, for our staff, for our kids, and they've done an incredible job. I mean, they've been a support to me, because I don't know how I would be able to get through this without the team that they are, and also the building principals, and the entire educational community of Mahopac. That's what we are about. We come together, we rally together, and I'm confident as 2021 continues and we get the vaccine, hopefully as we get through the end of this year and definitely next year, things will get back to whatever that new normal is. Also, importantly, we have a major bond. We're sitting in this library.
Yeah.
Okay? There is going to be a lot of work that is going to be done towards the end of this school year, the entire summer, into the fall of next year, and maybe into the spring, on this campus, meaning this high school, the facilities, water treatment plant. We're doing a lot of work. And in order to bring this building to where it needs to be for our kids, to get the best learning environment, there's going to be some pain along the way, Eric, and that's going to be moving people around, moving classes around as work is being done during the summer especially, but then, of course, during the school year. And when you see the transformation of what's going to take place in a lot of these spaces, it's going to be well worth it. But I need everybody to understand and to be patient.
Just to back up to athletics for a moment, I know you want to commend some of the young student athletes who are now being accepted to colleges and universities on scholarships.
Yeah, it's
prowess.
a great point. I mean, people think, well, we're in a pandemic. The kids are working just as hard as they've ever worked. I mean, we have like scholar athletic teams, our kids across the board are doing well. They've embraced what, remote learning is about. They're studying, they're getting great grades. Our kids are getting accepted to some of the top schools across the country. It's a tribute. It's a tribute to Dr. Lawrence, his team, and the work that's being done here. We're having, merit scholars, finalists, handfuls every year, and that's the work that we do as a district. And I always say that. The accolades always go to high school because that's the culmination.
Right.
But it really is that K-12, really depth and breadth of great instruction, rigorous instruction, quality educators, teachers, support staff that makes Mahopac a special place.
Will there be a graduation this year outdoors? There's a $64,000 question. Will there be?
I wish. Listen, I can tell you, and he would come and say this. Frank Guglieri, and he mentioned this on the call the other day. So those of you, Frank Guglieri is in charge of safety and health for Putnam Northern Westchester BOCES. And as you know, the Buffalo Bills are playing tomorrow. They're going to have 6,500 fans in the stadium. Frank said that the program that we worked on last year for high school graduation on the turf was more in-depth than what the Bills are doing. So I would like to say, I hope so.
Okay.
But with the understanding, it is not going to be the 3,000 and 4,000 people that we've been accustomed to. That is not changing between now and June. Yes, hopefully on the turf with everybody together and probably mom and dad socially distanced within the bleachers and whatever. That's hopefully what we can get to.
Okay, you heard it first, right here.
I said hopefully.
Hopefully.
I didn't say, but I said hopefully.
We have to eat.
Right.
People out there are hurting in Mahopac country. And when they understand that the United Way of Westchester and Putnam is teaming up with the Mahopac schools to get that food out there.
Yeah, I mean, and they're working closely with our assistant superintendent, Ms. Clohesi. We've gotten information out. There'll be information going out today in our weekly update about that. And we want to thank them because it is a community effort. And this is where the county, working with the school systems to be able to disseminate food that is so definitely needed during these very, very difficult times. And that's what partnerships are about.
Yeah, okay.
So we thank them very much and the county for working together.
So before we wrap up this edition, Greg, any farewell words?
I just want to wish everybody a happy new year. I believe 2020 is looking brighter and brighter as we move forward, and we're really excited to get our students back on Monday, and I can't wait to see all the wonderful accomplishments that they'll have by the end of the year, and hopefully we'll have graduation, and hopefully it will be on the turf.
All right. Anthony, what do you
No,
think?
I want to echo what Dr. Stolo said and what you said, Eric, just to everybody out there, peace and health, hope and kindness in 2021. We will get through these times together as a school community, and as a country. I mean, at the end of the day, we're citizens together. We should be helping one another. We should be encouraging one another. And most importantly, we should be respecting one another. So thank you. Thank you for all you do and all your support. And have a wonderful 2021.
And thank you for joining us for this edition of Spotlight on Mahopac Schools. For Assistant Superintendent Greg Stowell, Superintendent Anthony DiCarlo, I'm Eric Gross. Until next time, be safe. Bye-bye now.
For more information, please visit our website, www.mahopac.k12.ny.us. You can also find us on YouTube. Just search for the channel mcsd.news.